Welcome everyone to our webinar today. We are excited to have so many of you join us to learn more about the steps for planning and implementing evidence-based prevention on campus. I'm Jim Lang, the Executive Director of the Higher Education Center. The Higher Education Center is a national center housed at The Ohio State University. It works to provide tools, training, and technical assistance to the professionals working to address collegiate substance misuse across the continuum. We are grateful for our partners who are a part of this webinar, the Association of Fraternity Sorority Advisors, Holmes Murphy, and the Drug Enforcement Administration. Preventing substance misuse among college students is a team effort, and everyone on campus has a role to play in this work. I'm pleased to now provide our partners an opportunity to share more about their organizations, starting with Linda Wiley, Executive Director of AFA.
Thanks so much, Jim, and I am happy to be with you today. I am Linda Wiley from the Association of Fraternity and Sorority Advisors, and we are a higher education association that works to help our members be the best professionals they can be through education and resource development. And I am going to note something that Jim just said that I think is critical in our work, particularly when you are looking at prevention. I think that it has to be something that everyone is on the same page. If it is at an institution of higher education, if it is at a national fraternity or sorority headquarters, that the key really is that there is a strategy for the entire enterprise. I think it's critical that fraternity and sorority leaders are at the table and helping drive that agenda, but it really does need to be a comprehensive strategy. So we are excited to have you on board today and to be a partner in this program. So I will now turn it over to a friend of AFA, an expert in the field, Dr. Lori Hart.
Thanks, Linda. Hey everybody, I'm Lori Hart with Holmes Murphy Fraternal Practice. Echoing what Jim and Linda said, as we started this discussion, my word of the year was partnership at Holmes Murphy. And we have 90 fraternity and sorority clients that we're an insurance broker to and face all of the issues of higher education. And in my world of being in higher education for many decades, I know that there are a lot of smart people out there, and I know there's a lot of smarter people than me. So I certainly tagged into Jim Lang and his relationship with Rich Lucey, and we are thrilled to have him with us today. He is smart and he is informative, and the work that this resource has done, I think you're going to see and hear some amazing information from Mr. Lucey today. So a little bit about him as we get started. Rich is a Senior Prevention Program Manager at the Drug Enforcement Administration's Community Outreach and Prevention Support Selection. Rich plans and executes educational and public information programs, evaluates program goals and outcomes, and serves as an advisor to the Section Chief and other DEA officials on drug misuse prevention and educational programs. Rich formerly served as a special assistant to the director for the Center for Substance Abuse Prevention. He advised the director on policies and programs designed to support drug misuse prevention on a national basis, and advised the director on the center's efforts to prevent substance misuse and promote mental health among college students. Rich also worked as an education program specialist with the U.S. Department of Education's Office of Safe and Drug-Free Schools. As a team leader for higher education initiatives, he communicated the principles around evidence-based drug misuse and violence prevention strategies in higher education. So we welcome him today. We thank him for his time, and for all the 212 participants who are on the call today, thank you for being here. Rich.
Thank you very much, and good afternoon, folks. And to those of you on the West Coast, it will be a good morning to you. This is an absolute pleasure to be with all of you this afternoon. And I know that there's a couple of hundred of you currently on. We had close to 400 people registered for this webinar, which is so exciting. I've been to national conferences with not that many people, and it just says to me how eager and hungry people are for the information that I'm about to share and that we're about to talk about during this webinar. So thank you again for being here. Before we get to our first polling question, let me also say this is an unusual time, obviously, for all of us, a challenging time for all of us, and we try to do our best to continue the work that we're doing in prevention. But let me also say that I hope that you are doing everything you need to do to keep yourself, your family and friends, and your communities safe as we continue to flatten the curve and get COVID-19 pretty much under control so we can return to whatever the new normal will be for all of us. So if we were together in person at a hotel or what have you, at a conference and such, before I start a session, I usually like to do a little bit of a pulse check and find out who's in the room and kind of all your different roles. And so with that, I'm going to turn it over to Cindy, and we're going to get to our first polling question to see exactly who is here with us. So Cindy.
Thanks, Rich. So we would love to gauge who's in the room with us. I've activated a poll for you to respond. So if you can click the button that most accurately aligns with your role, that would be great. We'll give everyone a few seconds to respond. As Rich mentioned, we have quite a few people joining us. One of the responses we have is other, and if you are one of those people who don't fit into one of these categories, we encourage you to let us know in the chat who you are. So it looks like about half of the folks that are joining us are health and wellness professionals, and we have, of course, quite a few folks also from the fraternity and sorority community, which is no surprise given our partnership for this webinar. And we have lots of others as well, so we can kind of scroll through that chat and see a lot of community folks, it looks like, working in community coalitions or community preventionists, and also people with dual roles. Back to you, Rich.
Great, thank you so much, Cindy. I really do appreciate that. And I also say up front, you know, since so many of us are working remotely and we're carrying on these training efforts and what have you remotely and doing webinars, my mantra of late has been a little bit like all bets are off. So if we hear a bark or a meow or a crying baby or a laughing kid in the background, it's totally okay. It happens. In fact, my four-legged child who's sleeping somewhere, I'm sure, my cat Jackpot, who knows, he may even make a cameo appearance somewhere in the background and provide his 2 cents. So that'll just provide some levity to our presentation today. So thanks for letting us know who is in the room. That really is helpful for us. I started the presentation with, why is DEA in the prevention space? I get that question a lot when I am out on the road, whether I'm helping to staff our exhibit at a national conference, or if I'm out doing a presentation or a keynote at a national or statewide event. Make no mistake about it, the DEA, the Drug Enforcement Administration, our primary mission is enforcement. We are a federal law enforcement agency, and that is first and foremost our primary mission. Part of our mission, the second leg of the stool, if you will, is diversion control, where we monitor and enforce that closed system of distribution. We want to ensure that prescription drugs end up in the hands of the people who legitimately need them, and we certainly have agents who are out there enforcing and ensuring that those medicines don't end up in the hands of people who don't need them. So that's the second part of DEA. But the third part is where I'm housed, and it's the overall office is Congressional and Public Affairs. And as Laurie mentioned earlier, I work in the Community Outreach and Prevention Support section. And the fact of the matter is, we have been in the prevention space for the better part of 30 years. If you are familiar with the story of Special Agent Enrique Camarena, otherwise known as Kiki Camarena, you know his story. In fact, it was pretty much serialized over the last couple seasons of Narcos, Narcos Mexico, if you've been watching that. Kiki was kidnapped, tortured, and murdered back in 1985. Out of that horrific tragedy was born the Red Ribbon Week campaign, which I'm sure many of you know about, the annual health observance that we help to sponsor each October 23rd through the 31st. And so for the last 3 decades, we have been involved in providing drug information and education to a variety of audiences. So we're trying to, and I think we are succeeding over the last several years, no longer being the best kept secret in DEA. So this is another way of getting the word out about the prevention resources that we have, albeit for a very specialized audience, and we'll talk a little bit about that in just a few minutes. So our outreach to colleges and universities traditionally has been on 2 fronts. We are often on college campuses at career fairs where we are involved in recruitment efforts and talking to students who may be interested in a career at DEA, whether as an agent, as a chemist, intelligence research specialists, the professional staff such as myself as a non-agent, where there is a significant number of personnel such as myself who are working in DEA. So there are a number of careers that are involved. But the way other end of the spectrum that DEA has traditionally been involved with colleges and universities has been enforcement actions. And if you read the news and see on TV, unfortunately, there are drug trafficking incidents that do happen on college campuses, and DEA is involved in those enforcement actions. And so that's traditionally where we have been involved. And as you heard in my bio, it'll be 4 years next week that I was recruited to come work at DEA from CSAP, where I was the special assistant to Director Fran Harding. And I was recruited to come to DEA really for a couple of reasons. One was to help bolster their prevention expertise, building the capacity, and we talk about that as one of the SPF steps in a little bit. So happy to bring that knowledge with me to the agency. But secondly, it was to really enhance their community outreach and prevention support efforts for colleges and universities. And over the last few years, you're going to hear a little bit about the resources that we have made available to colleges and universities. And of course, today we're focusing on the most recent resource that we have available, and one that I am extremely proud of, and am really excited about the reception that it has received since we launched it this past January. So that's a little bit about why DEA is in the prevention space and a little bit about our outreach to colleges and universities. And so we launched this past January a strategic planning guide that is centered specifically around the strategic prevention framework, which hopefully many of you know what that is. I will refer to it here on throughout the webinar as the SPF, as it is affectionately referred to. And we really wanted to fill a gap, if you will. The SPF itself has been around for the better part of 25 years. Started at SAMHSA, my previous agency. And so that isn't new. But what is new is there had been no publication or resource that specifically aligned the SPF with efforts on college and university campuses. And so in that regard, we filled a significant gap, if you will, in the field by providing this resource. And so we designed it with the intention of providing a roadmap for folks such as yourselves to be able to collaborate with a whole range of stakeholders to address your campus-wide drug misuse prevention efforts, whatever they might be. And so there are 2 versions of the guide. There's a print version and there's an online version, which is on our website, and I'll talk about that a little bit later. The online version of the guide is about 70 pages longer than the print version, mainly because the online version contains all of the documents and resources that are tips and tools and worksheets that you can use to help you in the various steps of the SPF as you work through that. So there are online resources that are associated with each chapter. We organized it into 8 easy-to-read chapters with very helpful graphics, and we're going to go through that during the webinar. And of course, be very interested to get your reactions and the questions that you might have as we go along into today's webinar. And so, as I mentioned, the SPF, which has been around for, like I said, the better part of 25 years. So the guide really does walk professionals through how to use the SPF to help plan and implement their prevention efforts. There are 5 steps to the SPF, starting with assessment, going through capacity building and planning and implementation, and ultimately evaluation, all with the 2 central principles of cultural competence and a concept we also introduce in the guide called cultural humility, as well as sustainability, the 2 underlying foundations to the SPF, and why they are so important to be intertwined and interwoven into every step of the SPF as you carry them out. So keep all of that in mind as you know, if you haven't heard of the SPF, that's just it in a graphic with the 5 steps and the 2 underlying foundations. So why use it? And as you can see on the screen here with this slide, there are many advantages. First and foremost, it's data-driven. And you know, my mantra is that data drives programming in prevention. The SPF is designed to help you gather and use data to guide all of your prevention decisions, from identifying which problems to address, to choosing the most appropriate way to address the problem, to determine whether you're even making progress. And so good decisions require data. So that's one of the benefits of the SPF. It is data-driven. Secondly, it is dynamic, it is iterative. I mentioned that there are 5 steps, but I want you to picture it as a circular process, hence the graphic that you saw in the previous slide. It's not a linear process. You may start with assessment and work your way through to evaluation, but you will repeatedly revisit the 5 steps. Sometimes you will get up to evaluation, or rather implementation, and take a step back, if you will, to maybe make a mid-course direction if things aren't going as you had planned. And so it is a dynamic process, and it's an iterative process. And then lastly, people use the strategic prevention framework because it relies on, and it in fact encourages, a team approach. Each step requires the participation of a diverse group of community and campus partners. You know, I like to say that the reason collaboration is often seen as a cornerstone of an effective prevention program is because the issues are so complex when we're talking about drug misuse prevention that they cannot be addressed or solved by an individual. It does require a team approach. It does require a collaborative approach. And so that is another reason why the strategic prevention framework is used. And so I'm now going to turn it back to Cindy, and we're going to get into our second polling question. Cindy.
Thanks, Rich. So we do have another polling question for you. I'm going to open that up here momentarily, but we'd like to get a sense of what your experience is with the strategic prevention framework. So you should see that polling question now. If you could respond for us. Is this something that is brand new to you? You've never heard about it? Or do you have some level of familiarity with, as Rich mentioned, and I can attest to, SPF? We lovingly call it SPF. So we'll give everybody just a few more seconds to get their votes into us, and then we'll share the results. Okay. Looks like we got the bulk of everybody. So here's our results. So it's pretty split all the way across the board. About a quarter of folks joining us have never heard of the strategic prevention framework. Well, thank you for being with us today. And about half of folks have heard of it, but either have never used it or have only used it occasionally. And we do have about a quarter of folks who are using it regularly. That's great to hear. Back to you, Rich.
Great, that's awesome. And very interesting that we had 4 potential responses that you could reply to. And as Cindy said, they were pretty split across the way there. So very, very interesting to see that. So what we're going to do now at this point in the webinar is take a closer look at each of the different chapters and just give you a high-level overview of what you can expect to drill down a little further into once you start looking at the guide. And so we're going to take that look and start with our first chapter. And so in the first chapter, we do give you a bird's eye view, if you will, of the current landscape, providing you with some context in which prevention efforts on college campuses are being implemented. And so what you will see are these different sections. And so we provide you with a history of drug legislation that actually started in the 60s and taking us through to the present, because we thought it was helpful to take a look at that history and how it's affected the current landscape that we find ourselves in as health and wellness professionals who are working on these issues related to drug misuse prevention on college campuses. We provide you with some current stats and trends related to drug use among young adults, specifically college students. We provide some information on the groups of students who are a bit at higher risk for any number of factors. And so we talk about athletes, we talk about fraternity and sorority students. We talk a little bit about LGBTQIA+ students. We also talk about students with certain mental health conditions. We know that certainly the alignment of mental health issues and drug use, there is a lot of alignment there. And so in this chapter, we talk a little bit about those groups of students who are a bit at higher risk for drug use. And then lastly in this chapter, which didn't exist elsewhere, and so I was glad that we provided even just a couple of pages talking about this, some of the federal policies that affect prevention on college campuses. And I can tell you the three policies we specifically address that I'm sure many of you are familiar with, obviously are FERPA, which deals with the education records of students and how they can and cannot be released. We talk a little bit about HIPAA, which talks about the health records of college students and the ways in which they can and cannot be released. And then lastly, the Drug-Free Schools and Communities Act. As you heard in my bio, I started my federal career with the U.S. Department of Education, working in their Office of Safe and Drug-Free Schools, so I am intimately familiar with the Drug-Free Schools and Communities Act, what we lovingly refer to as Part 86, because it is the part of the regulations that affect college campuses. And for those of you that are doing this work on college campuses, you know these are the requirements that you must follow if your school gets federal financial aid, which the vast majority of colleges and universities in the country do, which says you must annually distribute your alcohol and drug policy to all students, faculty, and staff, and that every 2 years you must do a biennial review on your prevention program's effectiveness and the consistent enforcement of your disciplinary sanctions. Normally, those biennial reviews are done in even-numbered year, and with this being 2020, this is the year in which many universities and colleges are doing their biennial reviews, and perhaps with the time that you're now working from home remotely, this has given maybe you the opportunity to really delve into your biennial review and the writing of your report. And so what better time, I guess, for all the time that we're now not spending physically in the office to be working on that. And so this chapter gets into that a little bit specifically just to provide the overview. So we move into chapter 2 and talking about, now we started to talk a little bit about how to use the SPF to specifically prevent drug misuse among college students. And as I mentioned earlier, it's really crucial that we use data-driven processes as you design and you implement your prevention programs on campus. You know, just doing what feels good or doing something because it's the way we've always done it, or doing things because you think that's what students are going to like or enjoy, and solely that being the reason why you implement a particular program, that is likely not going to result in the impact that you want or you need on your campus. And so the SPF really does help strengthen your program. You know, this first bullet on the slide is something I've really been trying to drive home over the last year to 2 years in the various presentations that I've been doing. And that is saying that prevention is not random. You know, I try not to talk too much in sound bites, but sometimes these sound bites are really what catches people's attention. And prevention is not random. It must be purposeful, prevention must be strategic, and prevention must be intentional. And the SPIF really does help create that structure for you. It helps you make those decisions that are based on data and based on evidence-based practices. I really like the graphic that's on this slide here because this, in a nutshell, is what the SPIF process will help you answer. In a nutshell, what is the problem? What do I have to work with? What should I do and how should I do it? How can I put my plan into action? And is my plan succeeding? I have just outlined for you the 5 steps of the SPIF, just said differently with these questions. This is assessment, this is capacity building, this is planning, implementation, and evaluation. And so this publication guides you through that process to help you answer those questions. Moving on to chapter 3, now we start to get into the really nuts and bolts of the SPIF with the first step, with assessment. How do you begin that process? How do you quantify? How do you define the problem behaviors on your campus? And this chapter walks you through that process. You know, implementing a prevention program without completing and using the data from a needs assessment really is like building a house without an architect having designed the blueprints. I mean, how successful would the structure of your new home be without their input and that blueprint? It's risky. And the same goes for prevention. If you begin implementing a program without understanding the needs and environment of your college campus, you're at risk for not having an impact on drug misuse on your campus. I know that it's tempting to jump right into implementation. You hear about a great program that another college is implementing. You know, I'll use the national meeting, the Higher Ed Center's national meeting, as a perfect example. You know, I used to oversee the national meeting when I worked at Department of Ed. And fortunately, the Higher Ed Center at The Ohio State University has been able to maintain that tradition. I know this year is going to look a little different, but it's that kind of event where you might hear about a great program and you might want to go right back to campus and implement it. You're thinking to yourself, you know, why not try it? But, you know, if you haven't assessed what's happening on your campus and even figuring out if that's the right strategy or right program to implement on your campus, you really are setting yourselves up for failure. And so this whole issue of assessment really is the very first step that you need to be doing. And we take readers through these 4 steps, if you will, around assessment. As you can see on the slide, this whole goal is to put together a data-driven picture for you. So it is talking about the amount of drug use on campus. I mean, it's really good to have that quantifiable information, but you know, assessment can go well beyond just the survey and just the data snapshot of how much your students are using alcohol and drugs. And so you also can assess the risk factors and those protective factors that are placing students at greater risk for misusing drugs, and what factors are protecting students from the impact of using drugs. The third step is looking at capacity, and the next step of the SPIF gets into that a lot more intensively, if you will. But part of assessment is taking a look at how ready is my campus for prevention. So what resources exist? How ready are we to carry out these efforts? And then lastly, when you're starting to think about how am I going to share these findings, who's going to be interested and what format is going to work best? I can tell you, depending on your stakeholders, if it's business owners in the community, the students themselves, your president or other senior administrators, just those 3 examples, those are going to be 3 very differently formatted ways in which you share your findings. And you'll need to figure that out, what format works best and how we share our findings. And so that's a little bit about the first 3 chapters. And now I'm going to turn it back to Cindy, and we're going to get into our next.
Yeah, so we're now interested in learning a little bit more about what kind of problems, behaviors, or issues related to substance use have occurred at your institution or organization that need to be addressed. And this is a question because it is so broad. We're asking that you respond in the chat panel, which you can find at the bottom of your screen and under the chat button. So I encourage everyone to bring up their chat panel and just drop a couple lines about what are some of the issues that you are interested in addressing on your campus or that you've seen on your campus? So we'll give everyone a couple seconds to identify those and type them out. So we're starting to get some responses coming in. So people are looking at prescription drug misuse as a concern, rising rates of cannabis misuse, as well as secondary behaviors associated with high-risk alcohol use. The changing landscape of the legalization of cannabis is coming up quite a bit. Of course, alcohol use is a common concern that we're seeing. I see a lot of vaping as well coming through here, whether that be nicotine vaping or vaping of cannabis products, as well as drug overdoses being a concern. I've also seen a couple of comments specific to recovery and being able to support students in recovery, as well as supporting students who already have existing mental health issues. So I think that's a good summary of where we're at, Rich.
Yeah, absolutely. And my head was spinning, in addition to my eyes spinning, as I was watching the chat feature here as well, and all of the terrific input many of you had putting your issues down there. And let me say real quickly on just a few of the things that I saw. I didn't do any data slides, just in the interest of time. Vaping, I can tell you, nicotine vaping and marijuana vaping among college students, according to the Monitoring the Future study, doubled. Both of those substances, vaping, doubled from 2017 to 2018. The biggest single one-year increase of any substance seen in the last 40 years or so of the Monitoring the Future study. And that's among college students. Again, nicotine vaping and marijuana vaping. So many of these issues, these are workshops, obviously, in and of themselves. This is just great content. I saw some people talking about cocaine. Yeah, unfortunately, our work is never done in prevention. We know that it's not a finite type of situation where you've solved a problem, if you will. If you've been around in the field for as long as I have, for example, 30 years, for such a long time, people thought we had a really good handle on the heroin issue. Little did we know heroin would come back in such a big way as it was connected to the prescription drug misuse issue. We're seeing the same thing with cocaine, and a lot of that has to do with the immense amount of cocaine production that is currently happening in South America, and we know where that will end up is likely here in the United States. And so we keep our eye on the data. Again, it goes back to the data. Keep your eyes on what the data shows you, regardless of what instrument or study you like to follow. I can tell you, we look at the Monitoring the Future study. We keep an eye on the National Survey on Drug Use and Health administered by SAMHSA, and of course, the National College Health Assessment that is administered by the American College Health Association. And so there are certainly some others in addition to your own homegrown surveys that you use. So really great comments that I'm seeing there in that chat field there at the bottom. So we're going to keep moving along here with the high-level overview of the different chapters of the guide. And so now we move on to the step of the SPF that talks about building capacity. If you've ever been to a higher ed conference, and like I said, there are several, obviously the national meeting, and certainly if you've been to NASPA's strategies conference, just to name a couple, you likely will have seen a presentation that makes campus and community collaboration look really easy. The presenter might run the university's alcohol and drug office, They might describe how she works with law enforcement and local landlords and the alcohol retailers and the bar and the restaurant owners. And everybody seems to be on the same page and committed to building a healthy community for their students. And, if you're struggling to get your prevention program efforts off the ground, a presentation like that really can feel frustrating and demoralizing and overwhelming. And I get it. I've been part of a presentation doing that. I've also sat in the audience and felt that. First of all, I think we have to recognize as you are seeing the showcase, whenever you typically see those types of presentations. A really good presenter will give you the good, the bad, and the ugly. And sometimes just because of time purposes, they can't get into all of that in a workshop. But trust me, I am sure that they have gone through their moments of getting everybody on the same page and not finger pointing and blaming each other that due to student misuse and such. It is a long process of getting the campus's offices on just the campus on the same page, let alone working with the then surrounding community and all the different sectors that are involved there. So when we talk about building capacity, it really is, as I mentioned in the assessment section, taking a look at the combination of resources that are available. So working with the surrounding community for a campus is a great way to start leveraging resources and building capacity. And then also, again, taking a look at the readiness that the campus has to, have the will, if you will, to really put all their efforts and stand behind what they're about to do to make change on campus. And so many times people think of building capacity as being all about money. I will admit sometimes that is a struggle, especially now in this time of shrinking resources that are available. That is why leveraging is so important, not only in your immediate local community, but then also thinking upwards, say with your state agency. And that is a whole other conversation. But every state agency gets block grant money. And so sometimes a quick email or a phone call might spark some potential resource that you didn't know was there to then help build your capacity for what it is that you're trying to do. We provide some tips for you in this chapter that specifically looks at building the capacity. And again, just because the graphics look easy, that's not intended to make it seem like the process is easy. And you'll figure that out when you're reading the guide. I'm only providing you with a high-level overview, but we talk about these 3 different steps that are involved in building capacity. Talking about your community stakeholders, which groups of people do I need to connect with? Who do I have to bring to the table to help ensure my efforts are successful? How do I develop and strengthen the prevention team? Being really strategic, there's that word again. Be strategic about why you want to bring each new partner on board. Trust me, you are going to have people coming to the table wondering what's in it for me. You're going to need to be prepared to answer that question for them. And for many times, while you have disparate agenda items, if you will, as agencies, you will have a common goal, and that's what you want to focus in on. And then lastly, the step of raising community awareness of the issue. And so that's the chapter that talks about building capacity in those different steps. So Cindy, why don't you take us into our next polling question about building capacity?
Yes, so we'd like to get a sense from you, how could you build capacity to help you address your priority problem? And so I'm going to launch a poll right now. So you should see that here. There's a few different options. Of course, if you have other options that aren't noted, you're welcome to include those in the chat as well. But we'd like to take a look at what some of your what you might be considering in terms of strategies to build capacity. So we'll give everyone just a couple more seconds to submit their responses, and then we'll take a look. Okay. Looks like we've got the bulk of everybody, so I'll go ahead and share those responses. And it does look like the vast majority of you, 72%, are looking at a combination of strategies, including leveraging existing partners, developing new partnerships, and working with students.
Yeah, and it was great to see those results. And it usually is. I mean, typically, I don't want to say always, but it typically is a combination of all of those. And let me just say to the 3% of you who said you have no idea, it's totally okay. And that's probably why you're sitting in on this session. And there can be follow-up after this session that I'm sure Jim, Cindy, and others at the Higher Ed Center can help you with in that idea of figuring out how do I build the capacity that I need to be doing. And so just a quick shout out to the 3% of those people there. Okay, so we're going to now quickly move on to Chapter 5. And this is the planning phase. This is, you know, if you've spent time working to prevent drug misuse on campus, you know that there is a rotating cast of speakers and online prevention programs, workshop facilitators. I mean, heck, I mentioned it myself, you know, I'm not out on the circuit, if you will, but I'm often presenting at conferences. This is the second of 3 or 4, I've lost count, maybe 5 different statewide and national webinars I'm doing about the guide. You know, they seem to make the rounds from one campus to another. You know, one year social norms might be the rage. The next year, everyone's wondering about motivational interviewing and if that's going to work for their first year students, for example. In many ways, we are very fortunate to work among such passionate and committed individuals, and having an excess of interesting and diverse and engaging programs and workshops to work from. But sometimes that can be really confusing as well and make it difficult to decide what to do. And the SPF can help you eliminate that confusion. And so in this chapter, we talk about how to prioritize risk and your protective factors. What's more important? How likely are they to change? Looking at the interventions, are they evidence-based? Are they doable? Are they practical? How many interventions can you implement? You know, we as preventionists, sometimes we are our own worst enemy. We want to do it all. And we have to sometimes give ourselves permission that we can't. We just can't. And so figuring out what ones am I going to do and am I going to do them well? And then lastly, building a logic model and sharing that with your stakeholders. You know, for some, the phrase logic model might want to give you pause to run screaming from the room because you're just afraid of the whole process. Let me tell you, the online version of the Strategic Planning Guide has a template in the appendix that is a great logic model template that you can use. It basically, all you have to do is, and I don't want to simplify it by saying that, but the work of how to structure it's done for you. You really just have to fill out the boxes. So having that logic model really is very important and part of your strategic plan going forward. So Cindy, we'll move on to our next polling question.
Yeah, I think this is our final polling question today. And step 3 involves first prioritizing risk and protective factors associated with your priority problem. So in the chat, can you think of a risk or protective factor that affects your priority problem? So thinking back to what you initially submitted to us about your priority problem, we'd ask you to use the chat feature once again and think about a risk or protective factor that might be impacting that. So we'll give everyone a few seconds to identify what that might be and share it in the chat for us, and then we'll see what folks are saying. So we're starting to see risk factors around increase in accessibility to perhaps cannabis because of additional venues being available, whether socially or retail availability, protective factors around strong enforcement or environmental messaging, as well as support networks as another protective factor. The campus culture, perhaps being a risk factor that campuses are struggling with, the culture around what is seen as use being a rite of passage, perhaps, or other other partying cultures that might be happening on campuses, other risk factors including a lack of coping skills or resilience or stress, and using substance use as a coping mechanism. And also the impact on some of the relaxing policies that might be happening either on your campus or perhaps what we're seeing in our communities right now in response to the pandemic, even perhaps as well. So lots of great things coming in through the chat.
Absolutely. There's just a real nice variety of things that we're seeing there. And yeah, as I mentioned earlier in the assessment phase, assessment of risk and protective factors is an important piece. And that comes back in this whole notion of planning. As I saw all of these different risk and protective factors going by on the screen. And so you need to have that snapshot in hand to then figure out which risk and protective factors are we going to focus on. So we're going to now move on to Chapter 6, which is the implementation phase of the SPF. And, you know, again, before jumping into implementation, preparation really is needed. And so while it can be tempting to do that, the success of a prevention effort really does depend on completing some tasks before it begins. And so in this chapter, we talk about this very issue, about connecting with your key partners, communicating with them openly to make sure that they're all on board as you move forward. You know, collaboration's not easy. There are going to be bumps in the road. There are going to be some members of your coalition who are very strong-minded and have opinions about the direction in which the coalition's efforts should move, and it really does depend on getting everybody on the same page again about what's the common goal for all of us. Fidelity and adaptation, that's a whole workshop in and of itself, with the whole idea of implementation, is ensuring that you are maintaining the core components of the program while adapting. Prevention is not a cookie cutter process. There's another one of those sound bites for you. It never has been, never will be. And so adaptation often has to take place because each campus and its demographics and its culture are so different. But you do need to make sure you modify with care. And then lastly, what are those implementation supports to help you as you're planning? What are the ways to get people involved? How are you going to keep your leaders informed? And how are you going to get the word out to the broader community? And so this is the information that we want to impart in the implementation phase. And so in the next chapter, it's the last step of the SPF, which is evaluation. The $1 million question, it used to be 64,000, but I guess with inflation, we really got to bump that up to 1 million at least. How will we know if our prevention efforts are working? Without any kind of an evaluation, it's really like trying to look across the lake on a foggy morning. You might be able to make out a few objects, but nothing is crystal clear. You can guess about your effectiveness, but you won't have actual answers. And so in this chapter, we talk about the two different types of evaluation. Process evaluation. How were the efforts implemented? How was the process? So you want to evaluate that process. But then also the other type of evaluation, which is outcome, which is measuring the impact of the prevention effort, revealing whether or not your short and long-term results were produced. We talk about the 4 basic evaluation principles. We talk about ensuring that needs of the evaluation meets the needs of all your different stakeholders, ensuring that the evaluation is realistic, is it doable, make sure that evaluation is done in accordance with legal and ethical guidelines, that's part of the propriety issue, and then accuracy, making sure the evaluation is conducted in a concise and dependable manner. And then lastly, in a checklist format, we go through the 6 different tasks that are involved in evaluation. Again, not to oversimplify it, but we wanted to make sure we put it in a easy conversational way that was easily understood for a variety of audiences as they take on this very important step, because once you've completed your evaluation, it's likely going to either take you right back to assessment, or it may take you back to any other parts of the SPF as you start thinking about planning a new direction, or if you've had significant success, maybe you want to go back to assessment and capacity building because you want to start looking at a new population. And so that's why the evaluation step obviously is so important. We close out the guide with a chapter that focuses on advice, and it really was all born out of interviews that our contractor did with a number of staff around the country, such as yourself. And we zeroed in on the just really deep and helpful advice from one individual. I'm sure you know her name, Dolores Cimini. Dr. Cimini has been at the university for over 30 years, and she's produced a lot of peer-reviewed health studies and co-edited a book. She currently runs the Middle Earth Peer Education Program there and is the director of their Center for Behavioral Health Promotion and Applied Research. In this chapter, whether you're an established professional in this field or whether you're new to this field, we provide you with some really helpful advice, regardless of where you are in your stage of your career in working with this population and working to prevent drug misuse among college students. So again, that's another benefit of the guide. We really wanted to make it useful for, again, wherever you are in your stage of your career, whether you've been doing this for quite some time like I have, or if you're new to this field in an entry-level position, if you will, and you've just started on a campus and are trying to figure out what direction to take. And so that, in a nutshell, is where Chapter 8 will take you. So I wanted to, very quickly, I kind of went by it pretty fast. Another one of DEA's resources is our flagship resource, if you will. That's our website for professionals working to prevent drug misuse among college students, campusdrugprevention.gov. Here is where you will find a whole series of resources. We launched the website in 2017. We have a practitioner's toolbox and a student center that we launched last summer. This past January, a couple of weeks after the guide, we launched a peer education portal. So if you're working with peer educators on campus, there is an opportunity for them to submit their programming ideas to us, for us to post online, for people, students to share with each other. We currently have more than 81,000 subscribers, which is just amazing that we've been able to build up that resource over a couple of years. And so if you go to the website and specifically the prevention guide section of the website, that's where you'll find the online version of the guide. And so I do want to, as we start to close up here in the interest of time, I want to end you with these three closing thoughts. First of all, student drug misuse is an issue that is shared by all institutions of higher education. Clearly, it's more prevalent at some schools than others, but there is no school that is immune from this issue. Secondly, student drug misuse is not a problem of the campus alone, but rather of the entire community. It's impossible for college and university officials to succeed in reducing drug misuse on their campus if they don't work in partnership with the local community, with state government, with law enforcement, with community coalitions. And lastly, student drug misuse is a problem that will never entirely go away, and that's why campus-based programs and policies and the coalition work that's being done at the state and the local levels really does have to become a permanent part of the fabric of college and university operations. And so leaving my contact information up there, I think I'm turning it over to Anthony at this point. I want to thank you again all for being part of today's webinar and listening to me and participating in the polls. And I really do hope you get some value from the guide. And as always, we'd love to hear your feedback, not only on the guide, but other resources that you might find helpful that perhaps DEA might be able to produce to help you in your efforts. So with that, I'm going to turn it over to Anthony.
Well, big thank you, Rich, for sharing all of your hard work with us and sticking around to answer questions. So at this time, this is when we'll open it up for questions from our audience. If I can direct your attention to the bottom of your screen, this is where you'll be able to submit your question for Rich. We welcome all of your questions, and please feel free to submit them at this time. We'll field the received questions to our presenter as we receive them. But before we get started, I just have a few housekeeping slides we would like to review. We encourage you to learn more about becoming a member of the Higher Education Center, which includes access to our Screen U program. Screen U is a web-based screening and brief intervention referral to treatment program. We've recently launched a new demo of the program, so we encourage you to take a look. You can do so by searching go.osu.edu/ScreenU demo for access. And of course, you can learn more about the benefits of becoming a member by visiting our website at hecaod.osu.edu. And we'd like to share this slide with you just to show you the various ways that you can connect with us at the Higher Education Center and keep tabs on the work that we're doing. Just a friendly reminder that this session's recording will be uploaded to our website and YouTube page within 3 business days of today's live session. And so with that, we will start fielding some questions to you, Rich. We do have a question that came in just a little bit ago. I have heard the phrase that goes something to the effect of crisis is the enemy of strategic planning. Do you have any advice/tips for AOD professionals who may be in a strategic planning process on their campus or with their community coalitions?
Yeah, so absolutely. I've heard that phrase and others like it. It's extremely difficult. Prevention, you are not going to see prevention results overnight. That is just the nature of prevention. Prevention is all about long-term normative change. That's not to say that there can't be short and long, intermediate term wins, if you will. And that's where you want to focus to get to the long-term wins. But to your specific point, that sometimes crisis is the enemy of strategic planning. That happens, and for any of you who, and I have not, but certainly have talked with colleagues who've dealt with the unimaginable tragedy of a student death on campus, that certainly is a crisis that sometimes will actually jumpstart efforts on a campus. We've also known in our field that unfortunately sometimes it takes a tragedy to create change. And other times, a tragedy such as, and I've used, actually, if you read the view from the field that was posted on campusdrugprevention.gov, that was posted yesterday that I happened to write, I talked a little bit about how new normal changes from historic events, and a crisis such as the shooting at Virginia Tech certainly changed how business is done on college campuses. And at the time, it really diverted maybe some attention to drug misuse and prevention efforts on campus. That is a constant. We know that is unfortunately going to happen. I think the nice thing, though, about a strategic plan is that it is always evolving. It should be a living document, a living plan, if you will, and one that you can always go back to. So even if a crisis does divert your attention from your strategic plan, I think the beauty of a strategic planning process like the SPF is you can always go back to it.
Thanks, Rich. We know that oversight of the Drug-Free Schools and Communities Act is not within the wheelhouse of the DEA, but we're getting questions that are curious on if you have any insight from the federal level around whether there'll be some updates on the requirements that are required of campuses to be in compliance with the Drug-Free Schools and Communities Act.
Yeah, boy, there's another one of those million-dollar questions. And I certainly can empathize with you because we see this oftentimes at the government level when legislation doesn't necessarily keep up with best practice or the science of prevention. And I can tell you another example, not to divert from the question, but just as an example, the substance abuse block grant that is administered by SAMHSA, there is a 20% set aside for prevention in that. And the recipients of that money must focus on 6 specific strategies that are codified in the legislation. Those haven't changed in years, I mean decades. And yet, while they are still important 6 strategies, they really do need to evolve. And so, you know, the same is true, I think, for Part 86 and the compliance efforts. The guide that was produced, the compliance guide, if you will, that was produced by the previous Higher Ed Center has not been updated. I have asked, there are no plans, I can tell you, immediate plans to update that. I certainly can't, I don't work at that agency, and so would never speak on their behalf, but it's not in the immediate plans. I don't know why. But I will say that the basic tenets of the Drug-Free Schools and Communities Act are absolutely, in my opinion, without question, part of good prevention practice. And so while the guidance hasn't been updated in terms of electronic dissemination and that kind of thing, you know, the whole idea of ensuring that your campus is aware of your policies, whether it's student, staff, or faculty, and every couple of years taking a look at your efforts and making sure that they are aligned with prevention science, that's just good practice. So I don't think you need a guidance document, quite honestly, to help you do that. Now, that's not to dismiss and be dismissive of the question. I get it. Having the compliance, an updated compliance document would truly be helpful for those of you doing that kind of work. But, you know, short of the nuances of that, such as electronic dissemination and the, you know, the leaps that have been made in terms of getting information out over the last decade or so, while that's changed, the real crux of what's behind Part 86 in the Drug-Free Schools and Communities Act still stand. And so I think that, you know, that's the important part for me.
Thank you, Rich. We have another question for you. So we know data collection is a challenging task and sometimes students are over-surveyed. How do we go about gathering good data?
Yeah, survey fatigue is certainly a big issue. I mean, you know, not to make light of it, but how many times even just on our own personal lives, you know, think of all the different surveys we get by email just from the different vendors, retailers, and stores that we are members of and sign up for. Every time you turn around, they want a feedback survey. And how many times you just click out of it because you just don't want to do it. So, you know, when it comes to data collection, and I didn't mention it in the presentation, but I think first and foremost is be really strategic about what data it is you want to collect and why you're collecting it. Don't collect data for the sake of having it. And so it's, I think, perfectly okay to have a 1 or 2 page survey that gets at the crux of what it is you truly want to find out about your students. You know, the NCHA, I think it's perfect for what schools want to use it for. It's comprehensive, obviously. Some schools do it annually, some do it every couple of years. You know, it really does come down to, again, what's best for your campus. But I think being strategic about your survey and what it is you want to collect and why you're collecting it, I think, you know, and also helping ensuring that you're not setting yourselves up to overburden the students either. I mean, if they're looking at a 6-page survey, they might kind of roll their eyes and groan a little bit as well. So taking a look about, again, data drives programming, no doubt about it, but make sure you are being strategic about what data you're collecting.
Thanks, Rich. We are at our time. I don't know if you have a few more minutes to hang out with us. We have a couple more questions here. If you happen to be free, we can ask those.
I do. My next meeting is not till 3:30. So
hey, let's make use of
3:30
that.
here in DC, so I can hang for a little bit.
That'd be great.
Love just answering off the cuff questions and making things up as I go along. But you know, My motto is, I say this kiddingly, if you say it with a straight face, people will believe you.
Great. Well, those
But
of you
my
that are,
mantra all along, as I tell people, is if I don't know the answer, one of the things that I've held fast to in my career is if I don't know the answer, I know at least who I can turn to try and get the answers for you, and I do the same here. So.
that's a good mantra to have. Well, those of you that are able to stick with us for a few more minutes, we'll get through these last 3 questions. So this question is really thinking about kind of the environment that we're in right now, where we're all working remotely, and recognizing that that need will probably continue for quite some time. Do you have any suggestions for ways that campus community coalitions can work to establish priorities for this next academic year, recognizing kind of the constraints of working remotely that we're currently in?
This is, we're dealing with this too, I got to tell you, at the federal level as well. I have really good colleagues and friends that still, that are at Department of Ed, for example, that are dealing with the K-12 issue. And, we're dealing with it at DEA, I can tell you, just trying to plan. We had a meeting yesterday among the staff trying to plan our events and our projects around Red Ribbon Week in this October. And it's, my personal opinion, the future is such a big question mark right now. I mean, and it's so hard to plan around a question mark. And yet we're all being asked to do it, right? I mean, that's the hard part. You can't just say, well, I'm not going to do it. You got to be able to try and figure it out. I have been, in fact, Logan and Anthony know this, I joined the virtual water cooler chat a couple of Fridays ago with this very question as we were 2 or 3 weeks into coronavirus and dealing with the stay-at-home orders, is how do we help ensure that prevention efforts stay top of mind? How do we ensure they don't get put on the back burner, if not completely off the stove, if you will? Because we know that during stressful events and following a traumatic event, drug misuse will tend to go up. Alcohol and drug use tends to go up following a traumatic event and during stressful times. And so, now is not the time to take our eye off of prevention. And so I am encouraged, as I did a bit of an informal poll across a variety of stakeholders on campuses around the country a couple of weeks ago, asking them, how are you doing virtual prevention, if you will? I was really heartened and encouraged by the campuses who are finding ways to do virtual, whether it's Zoom or whatever other platform, a virtual class, say, for students who are mandated to attend a course, for providing a workshop on marijuana use, not just for mandated students, for all students, for counseling center staff and health center staff who are contacting students personally, either by phone or by email, to check in with them and see how they're doing. Also reminding them of the resources that are available to them and asking them, is there anything that they need? I think that that's all just part of our helping culture, quite honestly, is checking in with each other and making sure that we're doing okay. I would love to think that the new normal, whatever it might be, will involve people being back physically on campuses. I'm sure many of you, hesitate to say all of you, probably are looking forward to that. But we just don't know. And so we're trying to figure it out now, and we're figuring it out as we go along. Unfortunately, that crystal ball is really, really hazy. But if it's one thing I can implore of you is, to the best of your ability, please ensure that prevention stays on people's minds, that now is not the time to put it aside.
Thank you, Rich. I have another question for you. Do you have any suggestions about how statewide coalitions involving colleges and universities can go about strategic planning? Are there any adjustments to the SPF that they should keep in mind?
So one nice thing about the website, first of all, campusdrugprevention.gov, in the resources tab across the top of the page, go to state and local, and you'll see our interactive map. What we have done for you, and it's a little bit of a lift sometimes to keep it current, but we do our best. For each state, we provide you with at least 2 contacts. One, your National Prevention Network representative. That's the person who works in your state government agency responsible for prevention efforts for the state. We also provide you with your state's DEA contact, otherwise known as the Demand Reduction Coordinator. Now, granted, some field divisions cover more than one state. So let's say you're in, let's just pick a state. Let's just say you're in Pennsylvania, but your DRC, the Demand Reduction Coordinator, is housed in, I'm making this up just for sake of argument, is in Maryland. They will be able to still put you in contact with your local people in Pennsylvania and wherever you are locally, whether it's Philly, Pittsburgh, Harrisburg, Altoona, what have you. And so that's another benefit we've been trying to do with our outreach over the last couple of years, is putting the local campuses in touch with their local DEA, because sometimes agents will come on to campus and do presentations if you're interested in having that for students or for communities or what have you. You know, the beauty of the SPF is that the steps don't change. How you do the steps will. And so the other thing you'll see on the map, and there are about 30 or so states, and Jim, you can jump in and correct me if I'm wrong, because I know that you have done some work with a statewide initiative in California. There are about 30 or so states around the country that have statewide initiatives. And I can tell you, I'll just name you some names: David Arnold, Colorado; Joan Masters, Missouri; Jim Lang, California, are masters at the SPIF and how to incorporate the SPIF at a statewide coalition effort. I think the biggest challenge, and I cut my teeth on my career doing this again for the state of New York. You know, you talk about a disparate big state. You talk about the rural areas of the Adirondacks being very different than New York City. So the culture of the state and the demographics may be different, but it then comes back to what is the common goal for all those entities that are involved together in a statewide effort. Peggy Glider is another individual, and Karen Moses out in Arizona. These are just names, and I can follow up. If you write to me, you've got my email address, you want to follow up with me, I can put you in touch with these individuals specifically. But again, the SPIF itself shouldn't change, but it's really in the nuance of how you carry out the different steps. And with a statewide coalition, I think the biggest thing is just getting everybody as best as possible on the same page moving forward.
Great advice, Rich. I think we have 2 questions that we're going to wrap into one because they're both very specific to the DEA. And so there was one question about any sense on whether we'll have a fall 2020 DEA drug take back. And the second question is, are you aware of any planning grants that might be available through the DEA or the Department of Justice that could help support putting together some strategic plans?
So pretty easy questions, thank you, that I can have answers for. Let me do the take back first of all. So obviously because of COVID-19, we've postponed our April take back day. We implemented, hopefully you've seen it. If not, you can do a Google search or go online and look up Secure Your Meds. If you're on any of our social media platforms, whether it's Instagram, LinkedIn, Twitter, Facebook, if you look up the Secure Your Meds campaign, we rolled that out just a couple of, actually the week of April 20th, we rolled that out as a way of saying to individuals, families, and communities around the country that while we had to postpone National Prescription Drug Take Back Day, it is still an opportunity for you to secure your meds in preparation for the next one. Any rescheduled date has not yet been identified from the April date. but I can tell you, quickly pulling up the calendar and looking at October, it's usually the last week in April, the last Saturday in April, the last Saturday in October. Coincidentally, what is the last Saturday in October this year? Halloween. So I do not know if that makes any kind of a difference, but our plan as of right now is to, we are going to proceed with Take Back Day in October as planned. I can tell you also that one of our efforts over the last 3 to 4 years has been a partnership with IACLEA, the campus law enforcement administrators, and working with them to have colleges and universities, if not serving as directly as a collection site, because you do need to have a fully sworn law enforcement authority to do that, to be a collection site. But if you don't have that opportunity, then working with your local community to get involved that way. So that's what I know about Take Back. And then the other issue is, so first and foremost, DEA is not a grant, does not have grant-making authority. So we are not a grant-making agency. The Department of Justice, through the Office of Justice Programs, through OJP, they have grant-making authority, but I am not aware of any specifically planning, grants that would be available for that type of situation. But you've given me reason to at least make a note to say that not for this budget year, because obviously 2020 is already in the books, but as we start looking at 2021 and 2022, we do look that far in advance, that perhaps there might be an opportunity for a federal interagency partnership where such a thing could be available. I've been dismayed, it's unfortunate, and I've said it time and time again, the federal landscape as far as grants are concerned directly for colleges and universities has changed significantly downward over the last several years. There are grants available, both through Department of Ed and through SAMHSA. You just have to be strategic about how you're going to use them and how you fit and make them, work for you. But at this present time, DEA can't because we don't have that authority. But you've given me reason to think that, maybe that's something we could do with a partner.
Great. What a great way to wrap up. Thank you so much, Rich, for sharing more about the strategic prevention framework with us. We are looking forward to continuing this conversation and building on the work that we've started here. And so keep an eye out for an email from the Higher Education Center on what that might look like in the future and when that might be. So thanks to Rich. Thanks also to our partners at AFA and Holmes Murphy for helping to co-sponsor this webinar. And thanks to all of you for joining us. Have a wonderful Wednesday.